I am learning so much today. And I think one of the things that really impressed me about the last session was that doctors and medical professionals are people too. How many times have we been in a doctor's office and become intimidated or thought that they had all the answers, but they want better for us as well? And so I am so glad to be a part of this phenomenal summit. This next session, session 2, which talks about the importance of food and nutrition. Who in the world ever thought that in 2022 we would have a baby formula shortage? And how very relevant this next topic is to what is happening across our country today. And so the facilitator for this session is a very impressive young woman who has made food and nutrition an area of great concern and interest. Our facilitator for session 2 is none other than Cierra Washington. She is the strategic partnership coordinator for the Northside Co-op. She has a passion for food access and food justice. This passion led her to get involved with the Northside Food Cooperative, and after volunteering with them for a year, she was offered a full-time position. In this role, Ms. Washington helps to progress the timeline of the grocery enterprise, makes connections with local community agencies, and spreads awareness about the efforts of the co-op. I'm excited because New Hanover County has taken the challenge, and we are now building a grocery store on the north side of New Hanover County. When I was asked by someone, when did local government start building grocery stores? My response was, if the state can own a liquor store, certainly the county can build a grocery store. That was just something personal I came up with. And so without any further ado, the facilitator for this session is Cierra Washington. Let's give her a hand.
Awesome. Well, good morning. I'm so grateful to be here today, grateful to be in this community, and excited for our panel members to tell you all of the amazing things that they are doing and what you all can do with us, how we can continue to operate together in our communities. According to a report prepared for Congress by the Economic Research Service of the U.S. Department of Agriculture, about 2.3 million people, or 2.2% of all U.S. households, live more than 1 mile away from a supermarket and do not own a car. This is a characteristic of a food desert. A food desert is most commonly found in Black and brown communities and low-income areas. Now, we talk about food deserts a lot, but I also want to give merit to another word, and I know that we were talking about words a little earlier today, but a word that maybe describes what we're all dealing with a little better, and that's food apartheid. And so I want to offer a definition of that by Black food justice activist Katelyn Washington, and she quotes, "Oftentimes, people use the words food desert to describe low-income communities who have limited access to food. In fact, we do have access to food, cheap, subsidized, processed food. The word desert also makes us think of an empty, absolutely desolate place, but there is so much life, vibrancy, and potential in these communities." She coined the term food apartheid to ask us to look at the root causes of inequity in our food systems on the basis of race, class, and geography. Let's face it, healthy, fresh food is accessible in wealthy neighborhoods while unhealthy food abounds in poor neighborhoods. Food apartheid, she underscores, that is the result of decades of discriminatory planning and policy decisions. It begs the question, what are the social inequities that you see, and what are you doing to address them? And so as we talk today in our panel, I hope that you get to understand what all of these amazing people do every day and how we can begin to partner together to be able to address food access specific to the challenges of geography, finances, education, transportation, all of it. So many residents in the Lower Cape Fear do not have access to affordable, healthy food options, especially fresh fruits and vegetables. We hope you leave this session with a greater perspective and an urgency to address what's affecting our neighbors. So now I want to take a moment for each of our panelists to introduce themselves while also answering our first question, which is, how does your organization assist in access to affordable and healthy foods? And I will start with Miss Stephanie.
Thank you. Good morning. My name is Stephanie McDonald-Murray. I am a Regional Nutrition Extension Associate, or RNEA, for a program called EFNEP, the Expanded Food and Nutrition Education Program here in the Southeast District of the state. I am one of 8 RNEAs, and we have our roles include coaching paraprofessionals who actually teach or provide direct education, nutrition education to limited resource adults and children. And I also provide support to family and consumer science agents and agents through cooperative extension who also implement policy, system, and environmental changes in their communities. So I'm really excited to be here. I want to thank Ms. Velva for this invitation and her team for extending the invitation to us, allowing us to be on this panel. I'm excited to hear what the other panelists will say and what they will share, in hopes that I'll be able to use it in my work in my counties. It's kind of sad that we are still talking about this issue. I'm glad that we are talking about the issue because it's a real issue for so many people in our communities, but it's real and it's still here. And the pandemic, the coronavirus didn't help the issue, and even now, as we look around us, and we are experiencing food shortages, price increases, et cetera. And so those folks who were already considered to be our vulnerable population, limited resource adults and children, are at a place again where they are unable to secure healthy foods. But anyway, so the answer to the question is, as I mentioned, I work with EFNEP, or the Expanded Food and Nutrition Education Program. We've been working with limited resource adults and children since 1969. We've worked with them for over 50 years, providing nutrition education through the use of paraprofessionals who are indigenous to the population that they serve or come from the populations that they serve, providing basic nutrition, food resource management, budgeting as far as stretching the food dollars, et cetera. And as a part of that nutrition education, over the years, when we started the program, which was a pilot program in 1969 with Alabama State, who was really concerned about poverty in their state. So it started as a pilot program. The president at that time gave monies to be able to go into homes and to teach homemakers at that time or moms about nutrition and how to prepare meals for their families, et cetera. But we have since sort of transitioned just a little bit. We still serve the same population. Our mission is pretty much still the same, but we've transitioned somewhat to also implementing policy, systems, and environmental change, because we know that even though change takes time, change can occur. But there are multi-levels of change that has to occur. And so we are now implementing policy, systems, and environmental changes. So our ultimate goal really is to move those participants to becoming more self-sufficient, as well as helping them to become more healthy and well. So that's pretty much my answer to number 1.
Thank you. Gideon?
Good morning. Yes, my name is Gideon Adams. I serve as the Vice President for Community Health and Engagement at the Food Bank of Central and Eastern North Carolina. Try getting that on a business card. For a little over 40 years, the Food Bank has been involved with the sourcing of foods and provisions, primarily from philanthropic donations, and the distribution of those foods to emergency pantries throughout 34 counties of the state. We have well over 600, close to 700 partner agencies, those community organizations that actually distribute that food to those that need it. And without them, talking of community partnerships earlier on, without them we couldn't do what we do. But unfortunately, as the theme has been coming out today, we heard from the earlier esteemed panel, 30 years of working in this. We've now just heard about EFNEP working for 50 years in this, and the food bank for 40 plus years. We are still fighting this, this battle and not meeting the need that exists, a need that we've identified as not being met. And at that point, when the food bank meets the need that is identified out in the community, tomorrow we'll have to wake up and do it all over again. So in the last few years, the food bank has slightly changed its direction and started looking at the root causes of food insecurity and looking at more direct services. Part of those services have involved nutrition education. Part of those services have looked at connecting people with safety net programs to make their reliance on the traditional services of food bank less so. And part of that, that change has also been to move the imperative from providing food to providing nutritious food, which doesn't sound like a big step, but it is a big step. And as part of that, we have had to provide nutrition education and what we call food literacy around the provision of healthy foods, allowing people to understand what they need to do to consume those foods in terms of the handling, the cooking, and so on. We have now also moved into healthcare partnerships and health outcomes as part of our directive. We have a number of healthy pantries that look to provide nutrition education, outreach, and screenings for people. And we have a number of healthcare partnerships. We are expanding that as we go along, and then part of our new strategic plan is to continue the expansion of that. We have New Hanover is one of our partners within that, and Med North is actually just about to join as one of the partners with that, where we are looking to provide food as medicine. So lots of new things happening, lots of new partnerships that we are looking forward to expand upon whilst keeping our traditional services going until we actually meet that need.
Thank you. Katelyn?
Hi, good morning. My name is Katelyn Maddox. I'm the program director for Nourish NC. Nourish NC is a nonprofit here located in Wilmington whose mission is to provide healthy food to hungry children, empowering them to succeed in their classrooms and communities. So we actually got started about 13 years ago organically in Carolina Beach Elementary School, and that was because some parents and teachers were recognizing really disconcerting behaviors in their children, but particularly on Mondays. And they started to ask why Mondays were such a problem. Additional trips to the nurse's office, children who were having trouble paying attention in class, academic performance issues, and also getting to lunchtime and eating so quickly that they would make themselves sick or hoarding food, literally asking for seconds, things like that. And so they recognized it was because these children didn't have enough to eat on weekends when they were out of school. So the backpack program started serving about 11 children in Carolina Beach Elementary School. We have now grown to serve over 1,200 children from 54 schools across the county. That means that we are providing food to feed them during all weekends and school breaks. So during the school year, we're able to achieve that by sending a bag of food to the schools. It goes into the children's backpacks on Fridays. The bag is black. Ideally, the children get the food put in their backpack when they're out of class, so many of the children don't realize they're on any type of a food assistance program, let alone their classmates. Those bags are dietitian reviewed, and we make sure that the food items are kid-friendly and that the children can prepare them themselves in the need if mom, dad, parent, guardian is not home yet for them to prepare the food. One of the things that we have focused on is providing additional access to fresh produce as well. So we put fruit in that bag, it has to be hearty when it goes to the schools and into the backpacks and home on the bus, so we're not putting avocados in those bags. But ultimately, unfortunately, the reality is that the children know what the bag means as they start to get older. So we learned over time, and we shifted our model for our older children, that they come to our facility and pick up a box, which is the equivalent of all 4 weekends worth of food. This is also what we're able to do during all school breaks. The beauty of that is that we have really expanded our access to perishable items with that, them coming and picking up or us delivering to them. And so in addition to the pantry staples, we are also providing them fresh fruit, vegetables, frozen proteins, a loaf of bread, eggs, everything that they can have to encourage those healthy nudges is really what we're trying to work on in terms of educating those children. So we're not going to go full-blown quinoa and kale salad, but if you start to put broccoli in your mac and cheese, those little changes in access and experience with produce is what helps those children become regular produce eaters down the line. We did start with that backpack program. That's really what we're most known for. But over the years, we have continued to recognize our vision to be anywhere and everywhere children need us. So we've instituted programs like our Farmers Market, where we'll bring a fresh fruit and vegetable stand similar to a farmer's market into low-income parks, playgrounds, CEP schools, schools that have a high free and reduced lunch rate. And those children get Nourish bucks, they're little fake dollars, and they can actually shop for everything that they get in that produce stand and then get a recipe so that they're able to go home that evening, prepare that meal with their family, and experience new produce items that they may not have had access to in the past. We also do our Pantry Pals program, where we provide snacks or emergency pantries to other community partners who are serving the same food insecure children we are. So your after-school programs, your summer camps, your basketball camps, things like that. And then pre-COVID, we recognized that there are a lot of other agents in the community who are a new way to identify those food insecure children in our community. So we have a wonderful relationship with the school social workers who refer the children to us on our backpack program. You're going to hear from one of the rock stars later today. But ultimately, we recognize that doctors and nurses are seeing people who can identify children in the community who are food insecure. So we started our food pharmacy program. And that's where we actually have boxes in doctors' offices. We're working with a few different community partners, and those doctors and physicians ask 2 extra questions at intake. And if a child identifies as food insecure during their doctor's appointment, they leave with a box of food and a prescription to come get all of those fresh fruits, vegetables, meat, bread, eggs, all of those items. When we first started that food pharmacy program, we were using the boxes we were already making, but they're heavy. They're like 35 pounds, they're 12 by 12, they're big boxes. And we got some feedback from the caregivers and guardians who were leaving their doctor's appointment. They said, it's a little burdensome, it's big, it's heavy. So we made a slightly smaller box. And now we were producing a new product, and we said, what can we do with this? So we reached out to some of our other community partners. I'm sure it'll continue to be touched on today. We're all recognizing and learning the importance of our youngest children in our community, the first 2,000 days, our 1 to 4-year-olds. And so we started partnering with other agencies who are already serving those most vulnerable youth. And now those community workers through Smart Start and Coastal Horizons, who are doing home visits already for families and children who have been identified with being under-resourced, are taking those food boxes with them into those homes. And those children are also getting that prescription for the fresh fruits and vegetables. One of the really neat things, and I'm sure we'll continue to talk about it as we talk about community partnerships, is that it was actually mutually beneficial because we got feedback from those social workers that it was increasing their engagement rates with their families. They were more likely to have their follow-up appointment. One of our social workers literally called it his foot in the door, that the families were more likely to be engaged in their appointments. And so that was one of the really wonderful conduits of this partnership that we hope to continue to find opportunities to partner with other rock stars in our community who are helping address this issue.
Thank you. Skip.
Hello. I'm Skip. I am the clinical outreach dietitian at New Hanover Regional Medical Center, which is now Novant. My role at the hospital was inspired specifically from an outreach program with community paramedics that was trialed to see if giving free healthcare services for some basic medical needs would help prevent readmissions for certain populations of patients, specifically high-risk patients. With that inspiration, the question came out, would nutrition have the same impact? So the hospital started a grant-funded program to see if having home visits from a dietitian and also access to food boxes for those of the patients that are food insecure would have the same impact. I came in 2019, and within 1 year, we were able to establish the position as a full-time permanent position because the impact was so significant. Since that time, there are other community engagement programs that have been growing. Our community engagement manager is here today, and she has a wonderful team of community health workers that go out into the community as well and play an advocate role for handing patients off and navigating through some of these different processes. As we've mentioned, they're very fragmented, and sometimes an advocate makes a big difference. And then globally, the hospital's also trying to actually give food directly through food box programs, food pharmacies. We have several screening processes and delivery processes at different facilities. Some of them are working better than others, but we're constantly trying to assess how well they work and the impact that they have. Most of the work is really inspired, again, by some of the programs here that have been mentioned, but the hospital has a firm belief that those partnerships matter and is trying to increase the access that patients have to food in addition to education and healthcare along the way.
Thank you. So I want to take a moment just to orient our audience. So I think food is a very much of a level playing field for everyone. We all have to eat. We all enjoy food to some extent. We all need food to survive. And so when we're talking about some of the topics that you'll hear us mention today, I don't want you to check out as if it doesn't apply to you. Because whether you're a foodie and you like to eat tons of food and you have the money to buy whatever food that you want, or you're a person that works within a community with community members who may not have access to the food, we're all sharing this experience of food. And so our access to that food isn't just determined by our funding, which is what some of us really focus on, our community members who, struggle with the funding, but it can be your education. Do you have the knowledge and the confidence to cook with this healthy, fresh food that we're providing? Do you have the transportation access? Things like that. So I encourage you as we're talking today to get really creative with your understanding of what food insecurity looks like. So our next question is, what does access to healthy and affordable food options have to do with health equity? And I'd like to start off with Gideon.
Thank you. I mean, that sounds like a pretty simplistic question, right? What does it have to do with health equity? Well, we have heard so much today about the inequities that exist because of the status of individuals, right? Whether it be their color, whether it be their socioeconomic status. Clearly, we have seen that there is a barrier to healthy food for low-income individuals, and I'm going to sort of group that low-income individuals there as just as a matter of convenience. But it should be said that unfortunately, the system that we've also heard about today does group those individuals, and it should be recognized that unfortunately people of color are grouped as those that should be grouped together with the poor, and it's always been the case. That is what the system is built on, and so access to those to healthy foods really relies on the capitalist system that we work with, right? There are those supermarkets, those grocery stores that can provide healthy foods if you can afford it, in areas where there is a market to sustain that grocery and for them to make their profits. Unfortunately, in many areas, low-income areas, low-access areas, many grocery stores do not feel as though there is enough of profit to place themselves. And so access to that healthy food, the produce that they might have, is lessened. And we find that we have large swathes of our communities relying on convenience stores, on gas stations, and in some instances, if they are very lucky, the dollar store type of experiences that are out there. And what that does is really expose them to highly processed, massive salt and sugar added products, what has been laughably termed convenient food, and it's simply a case of it not being good for you, right? High fats, high sugars, high salts are going to have a toll on the body sooner or later. And so the inequities that come out, the health impact that has, is, I think, pretty obvious. I mean, it seems facile that I have to say that, but it should be obvious. I mean, we have examples where we have had interventions with young parents. And one that springs to mind is a young mom, 2 kids in tow, both below the age of 5, going into clinic, being screened as food insecure, being referred to the professionals, you know, the dietitians, for an intervention. All the work that's done, all the education that is imparted, all of the empowerment that we think that we are giving to these individuals, and at the end of the day, ask that mom, right, are you going to use this information to better your intake of food? And she said, no, I'm not. No. Because I'm going to go home and I'm going to have to walk the 2 miles to my local gas station where I'm going to get the food. There is 3/5 of nothing in terms of nutritious food there. And guess what? I have to walk back with 2 little kiddies who are carrying the groceries. So what we buy is popcorn and chips because that's all they can carry. That's the reality of some of the clients that we're working with, right? So we can wax lyrical about how much we're imparting knowledge and how much we're empowering people. We've got to, though, work with their reality and meet people where they are at. So that access, their access to healthy foods, in some instances is just theoretical, right? So now we have to look at practical ways to meet people where they're at, and that means direct service, that means last mile delivery of food, and that quite frankly means changing the system. And Ms. Rhodes spoke earlier on about how the system is working well because it's designed to fail for some people. But the reality is society is failing. Capitalism is failing. It's not looking after all of its citizens. And we need to change that system. A systemic problem needs a systemic solution. And although, yes, look within is a great solution to start us off, but without the system changing, we're not going to make many inroads.
Thank you, Gideon.
Can I chime in on
yes,
a little
please,
bit?
please.
So I just wanted to also add the fact that, I live in the clinical world, so I think of things as sort of pre and post diagnosis, and sometimes things can change dramatically after a diagnosis. And beyond just having the ability to find food to put in your mouth, there's also a relationship that is formed with food at many different stages in life. And the better that relationship can be, and the better you understand what power food has on your healing post-diagnosis, and again, all that's developed before that unfortunate news, the easier it is to heal once that happens. I have patients that access to food is part of the equation, but it's more access to food that they'll eat access to food that will help them heal, access to food they can tolerate. And those relationships aren't always obvious until the day comes that the doctor gives you, again, the bad news. On the after discharge, after diagnosis side, the ability to have equity does also come from that education attached to the food. Fortunately, I'm able to meet patients where they're at their home. But if you don't understand the principles of what food is doing for your body, and then you're left to your own devices, you may have the ability to get some food, but is that food serving you? Do you feel comfortable eating it? Do you feel safe eating it? So all those questions have to be answered. And I still think a lot of that can be built on the front end with what's going on with Nourish, with what's going on with the food bank, access to the food, and just experience with the food, having the ability to taste it. Not everybody eats the same foods for breakfast. Not everybody eats the same foods. I'm from North Carolina, so nothing's too terribly foreign from the patients I see from what I grew up with, but I lived in South Korea for a couple of years. The children ate kimchi and rice for breakfast. That was shocking to me. I don't know how they enjoyed it, but they loved it. And those relationships play a role later in their lives when someone comes in and says, well, a healthy breakfast is scrambled eggs and some fruit. Doesn't work. So we need to really establish that early on and throughout the lifespan.
One thing that many of our panelists have already talked about, and that you'll probably continue to hear us echo, is this importance of relationship building and meeting people where they're at, understanding people's situations, their circumstances, and tailoring our care and our service to them, particularly around food. And so when Skip was talking about the children in South Korea that he would help, especially in America, we have such a rigid view of what healthy eating is. We have a very Eurocentric view of what healthy eating is. And so we also have to be willing to stretch our minds to think about, okay, so what does our community already eat? How can we add those things, the broccoli to the mac and cheese, to encourage them to take those first, little steps on their own? And that's part of that empowerment, that self-sufficiency that we should be seeking in everything that we're doing for our community. So with that, let's talk about the long-term effects of unhealthy eating. And Skip, I'm going to pass it to you one more time.
Got on my soapbox there a little bit, but yeah, I think we all know the general long-term view of what unhealthy eating can do to an individual. The thing that I try to remind folks of is that if we don't have some understanding of what food is from a health perspective, then the diet that we choose, the lifestyle we choose, will not have some relationship with those health consequences later in life or the risks that we have. A lot of my patients, they did not know that food was playing a role in the place they were headed as far as their health. So they didn't consider themselves as eating unhealthy. And, again, there's a very individual approach to healthy eating for everybody. But having that education early, even if they don't make those choices, but having that education and access early helps that revelation be a little bit easier to come to. And then again, after the fact, on the other end, when patients get a diagnosis that I work with, a lot of times they have a very black and white mindset about what food is as far as health. This is a good food. This is a bad food. I should do this. I shouldn't do that. So I really try to work on detaching what the moral value of the diet you choose is, and just think more, again, about how it serves you in the immediate and in the long term.
Would anyone else like to add to that?
I can chime in on one aspect here. I think we have an interesting role at Nourish NC because in some ways we are very downstream. Putting food in the hands of a food insecure child is not solving the problem. We need to figure out why they were food insecure in the first place. Now, the flip side of that is if we're intervening when they're children, we have the Frederick Douglass quote above our door that it's easier to build strong children than to repair broken men. Mm-hmm. So I think that there's an important intervention early in life and helping them learn those exposures and experiences with food. We know that food insecurity is one of the reasons you're going to get a point on that ACEs score. So if we can make sure that the children are not food insecure, that's an important step. But one of the things that I sort of witness is this idea that services, so many social service resources have additional barriers and bureaucracies in place to accessing them. I personally believe that if you're eligible for a service, we should be inviting those people to come get it, and recognizing that any ways that we can make low barrier enrollment and access to services is an important step for all of us and all of our forms of services to be able to help. So for example, we don't have eligibility guidelines for the children on our program. We have people with letters behind their name that if they say that child is food insecure, I trust them. And if they say that if that family could be resourced with food, perhaps that's freeing up and allocating money or budget or time or whatever it is to go help them with some of the things that are higher barrier resources. And so I think recognizing that there's no reason to make it difficult for people to access the services that they're eligible for is something that we can all sort of take away in terms of helping promote health equity.
Thank you, Katelyn. So I want to ask our next question. I want to jump it over to Ms. Stephanie. What can communities that are located in food deserts do to access nutritious foods?
I think that one of the things that we can do is to connect farmers to communities, basically. I was looking at the news just recently this week about the tragic situation that happened in Buffalo, New York. And that particular area is a food desert, and that grocery store was placed there because it is a food desert. And because the store is closed now, they actually had a pop-up pantry there. And so having those opportunities like pop-up pantries, connecting those local farmers or local resources, making it easy for those farmers to be able to provide produce in communities, making sure that they are EBT or able to access those types of sources to be able to receive funds for bringing their produce to communities that are considered desert communities. So many options. Having the funding, locally and federal funding, additional funding, is also always a good thing. And just being able to provide what the community needs access to are good options, I do believe. I was trying to think of some others. I had written some things down on my paper, but everybody else is without paper today, so I didn't want to be the only one. But just those are just a couple that I can think of off the top of my head as far as bringing those resources to communities. I see Gideon is turning on his mic to answer too, so I bet it.
Thank you. Yeah, I'd just jump in. As Stephanie was saying, you know, the communities can get involved and looking at local food systems and the creation of local food systems. There is a growing network of organizations pretty much on a county basis, certainly on a regional basis of food councils that are involved with the creation of local food systems. And I think communities can get involved at that level. And a lot of that is about connecting with the agricultural resources that exist within North Carolina. I mean, we're very lucky that North Carolina is agriculturally rich. Unfortunately, the vast majority of that food does not reach the people who need it. And so that's where we kind of need to make those connections, and the community is the place to do that. Empowering farmers to actually be able to sell locally rather than, tie into big contract type scenarios where they're having to sell their foods out of the state. Is certainly one thing that communities can do. And I think we've seen during COVID the fragility of large global food systems, right? They can break down very quickly. You see now with the shortage that we have in formula. It's not a great example, but it just shows how that sort of single basket mentality, when it fails for everybody, right? And it fails on a global or national level. And so we need to start going back to systems that worked in the past where we have local supply for local people and putting a value on that.
And I think going off of that, something that we've learned at the co-op is really making sure that our small farmers, not the, necessarily the huge ones, but the smaller ones are still able to survive. I had a conversation the other week with one of our farmers who asked me if I wanted to buy her farm because she was like, I can't make money off of this anymore. Cierra, you want to take it? And so, we need to also invest in resources for our farmers to be able to survive because it is entrepreneurial. And it is physical labor, and it is all of these other things. And so if our county and our city are able to see the value in that, we would be a stronger food system because of it. So our next question, and probably our last before I open up for questions, is what can the school system and local government do to provide equitable access to meals when school is not in session? And I want to jump it over to Katelyn first.
Thank you. So one thing that I heard the term being called a COVID keeper, the things that we learned from COVID that we are able to continue to implement in the future. And I think one of the interesting things, and it actually kind of ties into one of the other questions we were going to touch on, but I'm going to touch on it a little bit anyways, is that when we lost access to our children, when the schools shut down, when we couldn't go to our appointments, when we couldn't go to our resources, we all had to think of how are we going to get there? How are we going to get those resources to the people in the communities that need them? And we had a really unique perspective during the pandemic because when schools closed on March 14, 2020, we had a oh shit moment. And then we realized okay, we're going to open a drive-through and we're going to feed these children. We're going to make food not be one of the problems that when we have all of these other exacerbated issues, food shouldn't be a problem. So we made the commitment to feed children 3 meals a day, 7 days a week, starting on March 17th in 2020 through a drive-through. But when we continued to, everybody kind of scrambled and everybody started saying, how can we get our resources to the children who need them? And a lot of community partnerships were built because we still had access to kids. And so we saw the other agencies, Dreams, the museums, the healthcare providers. We got safety equipment, we got face masks, we got books, we got all of these things, community resources from the other people who have the means to provide those resources to kids. And I think that was a real lesson learned. We all have our own missions and we all have our own goals in serving our clients or our folks that we're serving, but by partnering together and really coming up in the gaps is where we're able to all succeed and rise the tide for all the boats. And so I think that we also saw a lot of government interventions. We started giving extra money to families with children. We started sending checks to families, and that worked. We saw a huge peak in our numbers at the beginning of COVID. We had about 1,200 children on the program. We went up to about 1,700 during the first months of COVID school closures. Luckily, over that next summer and the next year, we saw those numbers decrease. Folks went back to work. Folks got those stimulus checks. The PEBT money was working. And so the families didn't necessarily, and we get the fortunate side where the families are coming to me and they're saying, Katelyn, we're better, give it to somebody else who needs it more than us. And so I think that there are a lot of ways that we saw the government work and we saw community partnerships work during COVID that can continue to be implemented in the future, or hopefully implemented and advocated for. We have to advocate for those resources to continue being funneled to the people who need them.
Thank you, Katelyn. Gideon?
I absolutely echo what Katelyn said. The idea that we sit silent and expect these things to happen, though, is naive. We have to actually be active with this. There were so many lessons that were learned during COVID that, as was mentioned earlier on, really just focused the light on the problem. And now we're moving out of that pandemic. Let's not lose the momentum that we created with some of the things, like some of the waivers that came into place for some of the federal programs. I mean, children being able to collect food locally, or even have food delivered to them, and it being paid for through the summer food service program, and not having to go into community and not having to eat communally, and that in itself being a barrier. Let's keep those practical things in place. But as soon as we come out of the emergency situation, the local government and the federal government say, okay, let's move away from those emergency situations. What they don't realize is food insecurity is an emergency situation now, and it's going to continue to be until it's done. And it's really imperative that, you know, the question speaks to, you know, what can the school systems do and the local governments. Well, the school systems pretty much can only do what the local governments allow them to do. And they work, I mean, we work with the school systems. They are working pretty hard all the time. To expect more of them, you know, I don't think is necessarily possible. But the resources need to be freed up, and they need to be freed up by the local governments. And if your local government isn't doing right by you, what are you going to do? Do something about that. I mean, that's what communities can do. That's what we can do. And I'm afraid to tell you that if you sit here and imagine that telling Katelyn or me, the food bank, or any of the community partners that are in the room, just do more of what you've been doing, and imagine that that's a solution, then I've got a bridge to sell you, because that's not reality, right? We need to change it. And we need to learn from these things that we go through, rather than just imagine that, oh, we've got past that, move on.
Thank you. I want to open up the floor to some questions from the audience. Does anyone have any?
I've heard a lot about food insecurity among kids and children, but what I want to hear too is food insecurity among older adults. We tend to focus on children a lot, but there are older adults out here for various reasons. Pride, for one, loneliness, lack of transportation, who also are suffering from food insecurity. So I want to know from the panelists, what are you doing for that particular population, and what can you do to support you in that effort?
Well, so I can only speak for what the hospital system's doing, which is a little bit more targeted approach. There are a lot of programs to capture those individuals when they come through the hospital. Unfortunately, they do have to come through for us to recognize them sometimes. But once we do, we often are able to connect them to some of these community resources, food pantries being one of them, food delivery programs. There are some insurance food programs that you can kind of find for patients depending on their insurance coverage. Still very fragmented. The senior centers in the community often have good programs. And then, as I mentioned, the community health worker team from the hospital, the community paramedic team, and myself trying to find the individuals who maybe are lonely, maybe do need that advocate, and help them through that path and support them through that path. And there's a level of care that's a little bit different for each of those healthcare providers, but it goes all the way from direct medical care to someone to check in and make sure that you have your needs met, and to get on phone calls and connect you with the resources and make sure your application goes through. So again, it's a very targeted approach, but we're trying to make sure that the individuals who need it really do get that direct attention.
Initially, thank you so much for the question. I mean, very, very important to recognize that population. We do hope that with the plethora of interventions that exist for kids, that maybe we can change their path, right, and get them out of that circle of poverty. For many seniors who are on a fixed income, that is a fixed income. Nothing's going to change that for them, and their circumstances are not going to change too dramatically. So again, I would say the idea of lobbying for programs like the CSFP, which is a senior box program, only came into North Carolina about 4.5 years ago. It's a federal program. It's existed. It's there as a program that can be used. North Carolina chose not to take it up until 4.5 years ago. We need to push for the expansion of programs like that. That is good food that can be delivered to their door. That's what we need to do. We need to advocate for the take-up of these programs for sure. We need to move away from the idea of philanthropic models and get into the idea of social justice models. And if there isn't a population that deserves our support after what they've contributed to society more than seniors, then I don't know who they are. It's the Commodities Supplemental Food Program, the CSFP. It's very much like the Emergency Food Assistance Program, which is the old government cheese program, but it's specifically for seniors.
Any other questions? Yes, sir.
Yes. How I think we sit here and we talk about what issues we have in the community, but it goes back to our state government. If we can't get legislators to go up and support our communities based on these issues, we're sitting here and we're going to keep grinding and talking about the same thing. We got to hold our legislators accountable when they go up to state government. Prime example, you're saying, how can we bridge the desert? If you educate these kids, what about hydroponic gardening? That's an issue that could be brought up in our school system and teaching our kids how to grow crops, grow things that's going to be edible for them, that's healthy. But if we sit back and we let our legislators, we vote the same folks in office, and they sit back and do nothing, and they see our communities suffer, but we let them go up to state government and they sit and they don't do what is recognizable and sustainable for our communities. We got to hold them accountable. They're going up in the short session soon. We need to advocate and we need to put pressure on them to hold them accountable for what they go up in office to do. That's one point right there.
Thank you for that. We have another.
A quick comment on that.
Yes, please.
I just kind of wanted to mention to that point, it's not directly addressing that specific example, but in concept, fighting an uphill battle to get a grant-funded program made permanent for a for-profit hospital was a challenge. And what we found was that when we were as passionate about measuring our outcomes and showing what we are creating an impact on, we got better feedback from the folks that don't see what we do every day. If you're there with the patients, the students, the clients, you feel the change, you are part of that change. But when you're at that C-suite, high 500-foot level, you don't necessarily experience it. And having hard, data-driven outcomes that you care about. I know it's not the fun stuff, but it is the stuff that people see and are willing to take chances on if they're not living the lives that we're talking about every day.
And just briefly, point very well made, sir. There are so many barriers that the legislators put in place themselves. There are programs, there are waivers that are available for us to use. And at the moment, the political climate, I'm afraid, is such that many possibilities are not being taken advantage of at the moment. And it seems to be, quite frankly, more out of ego-driven than anything else. It's people cutting off their nose to spite their face. There are opportunities out there, and absolutely right. We need to use our power to change their minds.
Thank you. Yes, ma'am.
So just more a couple comments. So I'm actually from California, and I was a nurse practitioner, and we did a lot of community stuff. And so one of the programs, we got a big grant, and we worked with schools in food desert areas, and actually did research. And one of the things that we found out was that if you switched, and kids for lunch, if they had recess first and then ate, they ate more. But if they had lunch first and then recess, they were in such a hurry to go out to recess that they didn't eat so much lunch. And if you reversed it, then they did. So that was an interesting thing that we tried to incorporate in schools. And then growing, this gentleman said, I mean, the younger kids up to, well, 4th grade, they had community gardens in their school, and they grew food, and found out that if kids grow it, they tend to want to eat it more. Then they would harvest the food, and the 3rd graders would do it like a lunch or dinner. Maybe it was usually a lunch for their parents, and that was really exciting. But we had a hard time keeping the grant funding, so we didn't be able to, we just couldn't get enough community partners. And then an unintended consequence of things was that we used a lot of adult volunteers to help with like the food growing and all that kind of stuff. And then in California, you couldn't enter onto a school campus unless you had been fingerprinted and all that, which cost $50. So then people couldn't volunteer because they couldn't pay the $50 to do the fingerprinting. So that was another creepy thing that happened.
Thank you for sharing that. Oh, yes, ma'am.
As you're talking about capitalism failed us, one of the food challenges that we all know is the prices, you know, for healthy foods, you know, for produce, you know. And we have to remember we have no legislations for food corporates to work on prices. So, or even for big hamburger chains. I don't want to mention names here, you know. So you go next door. If you have $10, you know, if I have $10 and I have to feed my family, I go to next door grocery. There is only $10 will buy me a salad bag for 2 for $5, and then maybe 1 cucumber for $1. How I'm gonna feed my family? I go next door, you know, fast food stores, and I can get 2 big hamburgers with the fries, whatever you want with, and that will cost me maybe $9. So we keep forgetting about also, you know, the prices and how cheap is fast food, and how we lack any legislations at states or national level to help these food corporates bringing more healthy options, cheaper options, and we don't have that, period.
Yeah, that's a great point. I mean, for many years, arguably from the 50s onwards, you know, there have been the sugar corporations and the like who have, quite frankly, bought and paid for rules and regulations, right? And so that legislation does not exist, and it is, I'm afraid, it's just another symptom of the system. You know, the idea of the capitalist society and where it might fail. I mean, I look to the people who remember not so very long ago the trade mitigation problems that we had, right, where we had a political punch-up with China, and China stopped buying foods from us, and you know, it was, you know, a lot of the farmers struggled with that. What actually happened with that food was that it was then bought by the government as part of their commodities program, the Emergency Food Assistance Program, and was pushed out through the network of organizations like food banks who distribute that food out to people who need it. What was never mentioned was the idea of the government taking taxpayers' money, supporting a national industry, the agricultural industry, taking those commodities and distributing them free to people who needed them. Anybody who knows anything about economic and political systems, that smacks of socialism to me. And everybody was happy for that to happen, but nobody mentioned the word socialism. But we sit in this idea of capitalism is the way forward. And if you were to find a way to make money out of beating people up, it would be seen as righteous. It's all about greed, and I'm afraid it's the industries who have dictated those legislations, and they still dictate those legislations, and that's why we don't have them in place.
Thank you. So that is the end of our panel discussion. I want to leave you all with a few notes to take with you as you continue out the day. A lot of things echoed today. I would say partnership and collaboration is important. Continue to partner, continue to collaborate. If you're a community organization, continue to look for other organizations that you can collaborate with, especially in terms of getting food out. I know Nourish has many programs where you can collaborate with them as well, and the food bank to be one of their partners. Another thing is self-sufficiency, looking at our community members and creating solutions where they can be empowered and self-sufficient. And a lot of that does go back to legislation and what we are doing and the programs that we are advocating for. So we thank you all so much for your time today.
And another great way is to become a member of the Northside Food Co-op, because if you become a member, it allows a discounted rate for a community member who may not otherwise be able to afford the full membership. Easy action item for you today.
Thank you, Katelyn.